Okay. So like Mike said, my name is Emelie Bailey, and I'm joining you from the Ohio Colleges of Medicine Government Resource Center. And I'm actually presenting today on the results of the evaluation that we've done on the last fiscal year's data from this program. So I hope that everyone finds it helpful. So just to start off, a quick disclaimer. The Ohio Systems of Care Project ECHO for Multi-System Youth is funded by the Ohio Department of Medicaid and the Ohio Department of Mental Health and Addiction Services, and it's administered by the Ohio Colleges of Medicine Government Resource Center and implemented in partnership with the Ohio Department of Developmental Disabilities. The views expressed in this presentation are solely those of the authors and do not represent the views of the state of Ohio or federal Medicaid programs. So now that that is out of the way, who are we? We're a health policy research center, and we provide research for organizations and state agencies like the Ohio Department of Medicaid and bring together healthcare, state, and academic leaders across the state and nation to improve healthcare in Ohio. Our role on this project is to administer the Ohio Systems of Care Project ECHO for multi-system youth. I'll refer to it as MSY ECHO on behalf of ODM and OhioMass and in partnership with DODD. So on the bottom, this is our amazing team who made this evaluation possible. Fei Jiang, Ann Robinson, and Dr. Kara Whalen-Smith. All of the work presented today is the result of a collaborative effort between this team and our partners at NeoMed. So the goal of the evaluation was to understand the impact of the Ohio Systems of Care Project ECHO for multi-system youth during state fiscal year 2021. So that's July 2020 to June 2021. We used the following data collection strategy, including collecting data on session attendance, post-session surveys, case presentations, case presenter surveys, and an annual survey. So we'll start with the session attendance. There were a total of 46 Project ECHO sessions held with a total of 1,980 attendees in the past year. 436 unique people attended sessions, and participants were primarily affiliated with developmental disabilities, behavioral health, or FCFC wraparound systems of care. And you can see the breadth of the session attendance by county. So we had attendance from 60 counties, and you can see the dark green represents greater numbers of attendance. As far as the post-session survey results, the post-session survey was distributed weekly after the Project ECHO sessions from July 2020 through May 2021. And we received 442 responses for a response rate of 25%. 68% of survey respondents reported providing services to people insured by Medicaid. 93% of responses were from the systems of care of DD, FCFC wraparound, and behavioral health. And 80% of responses were from SSA, social work administrator, and FCFC professional affiliations. As shown on this slide, over the course of the year, the vast majority of survey respondents reported that they strongly agree or agree that the following were valuable to their work: the recommendations, case discussions, new ideas, supports, or treatments, didactic presentations, and case presentations. So you can see in the blue bar that strongly agree or agree is represented. Moving into case presentations. So this figure shows the case presentations for the MSY ECHO by county. And you can see the DD quadrants in dark gray. The darker orange shows more case presentations over the year. There were 44 case presentations from 24 Ohio counties. And the reason there are fewer cases than sessions is because there were a couple of sessions that had case presenters give an update to the learning community rather than a new case presentation. So this figure shows, or this slide shows the systems of care and the system involvement for cases. So of those 44 case presentations, there were children addressed who had complex needs ages 6 to 22. The cases most frequently involved the FCFC, education, and behavioral health systems of care. Each case had multiple diagnoses ranging from 2 to 19 per case. The diagnosis categories that were most often reported were behavioral health diagnoses, intellectual and developmental disabilities, and physical health diagnoses. We also collected rated key themes from the priority case presenter questions for the MSY ECHO learning community. So those questions that are presented to you during the case presentation. And so those key themes were recommendations for evaluation, assessment, monitoring, treatment, and medication options, supports and resources for the family, and behavior management strategies. As far as the case presenter survey results, we can see those results here shown by the black stars in the case presentation counties. So that survey was distributed 2 months after case presentation to give folks some time to implement the recommendations. And we had 32 case presenters respond to the survey, representing 25 unique cases from July 2020 to April 2021. 88% of survey respondents reported that a follow-up or wraparound service coordination meeting occurred. 94% of survey respondents used the recommendations provided by the MSY ECHO. The reasons that were cited for those two cases who indicated that their team did not use, and that they, in the light blue, who indicated that the team did not use any of the recommendations, told us that they had a difficult time getting the family to follow through with the recommendations and that the family decided not to proceed with the wraparound process. And all of the respondents on the right, you can see that all the respondents reported finding the recommendations either moderately, very, or extremely effective in assisting with their case. The survey respondents reported that the top 4 most beneficial aspects of presenting a case were the specific recommendations received, the availability of the experts, the general discussion and processing, and the resources and links provided afterwards. So getting into the annual survey results, the annual survey was distributed to all MSY ECHO attendees throughout the month of June of 2021. 61 individuals from 46 Ohio counties completed a survey reporting on all of the overall impact of the FY21 sessions. So we had a 14% response rate. 89% of those responses, the respondents were affiliated with the DD, FCFC wraparound, behavioral health, and child welfare systems. And more than half of the participants who responded to the annual survey had professional affiliations of SSA, FCFC, or administrator. 79% of respondents reported providing care to Medicaid recipients. So one of our big findings from the annual survey is that the majority of survey respondents have applied lessons learned from the MSY ECHO to other complex cases in their practice. One survey respondent reflected the following about their MSY ECHO participation. Participation has enhanced my connections and networking within the MSY support community more than any other experience that I have had around MSY. Participation has provoked new ways of thinking about support strategies and has enhanced my fluency in MSY challenges and strategies for success. The majority, and in many cases, the vast majority of survey respondents felt that participation in the MSY ECHO sessions help them to plan or make changes in their practice related to educational supports, self-management, patient education, clinical procedures, treatment, and screening processes, diagnostics, and resources, as shown in the dark blue. Nearly half of the annual survey respondents had actually presented a case in the past year. So of those survey respondents, 96% used the recommendations provided by the MSY ECHO team. The team that indicated that they had not used any of the recommendations reported that they were just still in process of implementing several of the recommendations. And on the right, all of those who responded reported that the recommendations were moderately, very, or extremely effective in assisting their case. And then finally, we have some new information about who is attending sessions with regard to their career stage. So nearly half of all survey respondents reported being in the first 1 to 5 years in their current professional affiliation, and more than half reported being in the first 10 years of their current professional role. As far as session attendance goes for case presenters, we see a drop off after the first 1 to 4 sessions of attendance. Participants who did not present a case had higher attendance, as shown in the chart on the right, and rated the project higher than those who did present a case. So what does this all mean? So the survey results across post-session, case presenter, and annual surveys were overwhelmingly positive and show very encouraging findings in learning and changes in clinical practice. Case presenter survey results show high satisfaction with the elements of the ECHO process and found recommendations to be effective in helping with their cases. A high proportion of early career annual survey respondents indicates that the project is reaching the target audience of professionals who are learning or newer to their roles. Some of the opportunities that we've identified through this evaluation include expanding attendance to counties with no attendees or systems of care that had low representation in the last fiscal year, providing additional resources for frequently asked questions or recommendations for case presenters, enhancing the support for case presentation teams, especially after completing the MSY ECHO presentation, such as encouraging coordination with the presentation team and the local FCFC or DD regional coordinators, and then providing encouragement for case presenters to join additional sessions. Some of the next steps for us include using this evaluation to identify new opportunities for outreach and engagement, continuing to collaborate with our state agency partners, NeoMed and SIP, to improve evaluation information collected in the current fiscal year, SFY22, so that we can further understand the impact of these project ECHO sessions and ways to improve the sessions. And then finally, we are in the process of developing an MSY ECHO toolkit with themes and resources that are developed from the case presentation recommendations. And those will be available on demand to the MSY ECHO learning community. So stay tuned for updates in the new calendar year. And I hope you see now where the evaluations that you have filled out throughout the year are going and will continue to fill out, hopefully. Your feedback is really essential to our work. So thank you to the learning community for your contributions. And we look forward to receiving your surveys over the next year. Thanks so much.